Greetings, and today we are going to talk about why you have back pain and what you can do next. My name is Dr. Jeanette DeWitt. I am a physical therapist and athletic trainer and a fitness coach. And this is probably the number one question I get is, why do I have back pain and what do I do about it? Well, we are going to answer that today. There are several reasons that someone might have back pain. First of all, it could just be a muscle strain. There are huge muscles in the back, and seriously, on a cadaver, they're about this thick. And when you strain those muscles, because they are so big, they are going to let you know about it. The other reason a muscle strain can be so debilitating is because the only time your back gets to rest is when you are actually resting, like when you are lying down. If you are sitting, if you are standing, if you are walking, these are all activities that require your back to do work. Otherwise, you would just fall over. So the only time that your back gets to rest is when it is lying down. So, number one, you could experience back pain from a muscle strain, a pulled muscle, a muscle that's been overworked or overused or has just maxed out and fatigued. What can also happen with that muscle is that it can have trigger points in it. And trigger points are basically a muscle knot, a muscle spasm. It's where the muscle has become shortened. For example, if I have a muscle that is like this is its normal length, and it starts to knot up, it's going to shorten. When it shortens, it is not as effective in doing work. When a muscle does work, it has to shorten. So if it's already shortened, it doesn't have as much work or much give to do its job. That is where manual therapy, soft tissue mobilization, we do something here called precision neuromuscular therapy. It intervenes, it breaks up the trigger point so that the muscle can be restored to its normal length. What happens when you have back pain? Those muscles can kind of seize up or lock up, or it feels like somebody's jabbing you in the back. That's never a good thing, but that can be muscular. That's very preventable through flexibility, through good body mechanics, but it's also very treatable through soft tissue work with a physical therapist or massage therapy with a licensed massage therapist. Now here's where trigger points can wreak havoc. I'm going to show you a picture. Sometimes people can have trigger points and they create symptoms down the leg. And a lot of people will think that that is sciatica. That's not sciatica. There are trigger points that are bunched up and can put pressure on the sciatic nerve and mimic sciatica. So what happens is you can have a trigger point and the gluteus medius muscle, and that will create back pain along the pelvis or on the buttock area. You can also have back pain and sciatic symptoms because of trigger points in the gluteus minimus muscle. And that mimics sciatica because when those trigger points are affected, symptoms occur down the leg. Most people will think, oh, I've got sciatica. That may or may not be the case, but first thing is we'd have to rule out that the gluteus minimus does not have a trigger point in it. So you can see also in this diagram, trigger points into the buttock muscles, like the gluteus medius, like the gluteus minimus, send symptoms into the buttock region and down the back of the thigh. This is the piriformis muscle that the sciatic nerve often is interrelated with the piriformis muscle and can mimic sciatica. So that is the number one reason why people can have back pain or sciatic-like symptoms, is simply from a muscle strain or trigger points in a muscle. There's actually nothing going on with their spine, the discus of the spine, or the nerves itself. The muscles are connecting and relating pain or relaying pain into those regions. Now, another reason that someone might have back pain is disc problems. Disc problems could be loss of height in the disc just from aging, or there could actually be a herniated disc where the disc is bulging backwards into the spinal area and putting pressure on nerves. That can also cause sciatic symptoms. So let me show you another diagram of the disc. So if we look here, this is a disc right here. This is the bone. So you have a bone and the disc. This big white area here is a ligament. This here is space. And then this is the bony part of your spine that you feel on your back. So this disc here, when it bulges, it typically is going to bulge backwards or to one side. That's why some people will have disc-related symptoms that cause right side or left side symptoms. This space here has a nerve that comes out of it. When this disc protrudes or bulges, it puts pressure onto that nerve, and that nerve lets you know about it. It feels like numbness, it feels like tingling, or it can be radiating down into the buttock area or into the back of the leg. The other thing that can happen that can cause back pain is if this space starts to get bony deposits on it, like arthritis. That can create stenosis, or a narrowing of this space, and that narrowing puts pressure on the nerve and can cause back pain or sciatic-like symptoms. So as you can see, if we go back to our conversation about the disc, if the disc bulges, think of a jelly donut. So you have the dough part of the donut, and then you have the dough part of the donut, and then you have the jelly. If that jelly leaks out, there's less space, it puts pressure on the nerve, and you can have nerve symptoms. Just because somebody has a disc herniation or a bulging disc does not mean they have to have surgery. Physical therapy can actually help with that through very specific exercises. Now, one other thing I want to show you that can cause back pain is poor joint mobility. If we look at this diagram again, all of these areas here, those are joints. They're actually, it's a fancy word called zygapophyseal joint or facet joint. I like to say facet joint because it's easier to say. But these facet joints can get tight, and if they're not mobile, that can create symptoms in the back. It's called facet joint syndrome. So now we have several reasons why somebody might have back pain. We have a muscle strain, we have trigger points in the muscle, we have a disc issue such as a herniation or bulging of the disc, we have stenosis, which is a narrowing of the space that allows the nerve to come out, and we also have facet joint syndrome, which is an immobility of the facets at each level of the vertebrae. We also have one other thing that can cause back pain, and that is called SI joint dysfunction. So if we look at this diagram down here, we have your sacrum and we have the pelvis. Sacroiliac. This joint here, which you see these white structures here, that's ligaments. This joint doesn't move a lot, but it should move a little bit. When this joint is not working properly, it's called sacroiliac joint dysfunction or SI joint dysfunction. Two dysfunctions can happen. It can be hypomobile, meaning it doesn't move very well, or it can be hypermobile, meaning it moves too much. If it doesn't move enough, it can feel like it's stuck, or it can feel locked up, or it can feel really sharp. If it moves too much, somebody might feel a little unstable. I like to think of a person who is pregnant or who has just delivered. Because of the hormone relaxin, their ligaments are all relaxed and their pelvis can feel kind of unstable because it had separated and moved so that to allow the baby to be delivered. That is not normal though when you do not have those hormones circulating around. You do not want a hypermobile pelvis or an SI joint because it will feel unstable. Somebody will feel really sharp pain. It'll hurt to walk, and it'll be very, very uncomfortable. All of these things can be treated with physical therapy and with the correct prescribed exercises as well as the correct types of manual therapy. So what is the next step if you are experiencing back pain? Well, the first thing is to find out what the root cause of the problem is. And how do you do that? I recommend seeking a doctor of physical therapy like myself to do a discovery visit. This could be a telephone consultation, it could be an in-person consultation, or I also offer video chats through a HIPAA compliant video platform where I can talk to the person. They can actually meet me face to face and they don't have to come in to the office. Once I learn a little bit more about what the person is experiencing, I can determine if I am the first best option for them. Is physical therapy the first option? If somebody is experiencing loss of bowels or loss of bladder control, or they have foot drop, I am not the first best option. They actually need to go seek an urgent care or a physician immediately. Those three things, those three symptoms, loss of bowel or bladder and a foot drop, are medical emergencies. I am not the best person at that time. If you are not experiencing those three symptoms, I more than likely can help you immediately. And that's where I would recommend a full evaluation with a physical therapist to prescribe the correct treatment based on what the tests reveal in the evaluation. There are multiple tests that I conduct during an evaluation to determine what the root cause of the problem is. Based on those tests, I can determine if somebody has a muscle strain, if they have trigger points, if they have disc pathology, such as a herniation or a suspected herniation, if they have stenosis or possible stenosis, if they have piriformis syndrome, which is a specific muscle strain or trigger point of the piriformis muscle that creates sciatica. I can also determine if they have SI joint dysfunction. I can determine if it's hypermobile. I can determine if it's hypomobile. I look at all of that on the first day that somebody comes to me, because based on what I find, I will create a treatment plan around that. Does somebody need to see a physician first? In my state, they do not. They can come directly to me and I can evaluate them and treat them without a physician referral. Having said that, some insurances might require a physician referral or might allow me to do an evaluation first, but then they want a physician referral after that, or they want to see my notes to authorize further treatment. Every insurance plan is different. Every state is different. So you're going to want to check your state to determine what your next step is. But in my state, in the state of Wisconsin, I can see a person without a physician referral. Now, in any state, you can at least start a conversation with a physical therapist. And that's usually the first step that I recommend, is if you are experiencing back pain, if you're not experiencing bowel or bladder loss of function, and you do not have a drop foot, where you can't pick your foot up or you can't pick your toes up off the floor when you lift your foot. If you are not experiencing those, I encourage you to take the next step in helping reduce your back pain by starting a conversation with a physical therapist. If you have any questions, please go ahead and put them in the feed below. You can also just private message me. Whichever one you feel more comfortable with is fine with me. I will get back with you. Thank you so much, and I hope you give a great day. Bye.